So I'm just waiting for a visual confirmation that I'm live. Okay, so I can see myself live. Welcome everybody. So again, we have started this series of session for this month where I'll be talking about all the high topics of uh, in terms of MCQs, because most of the times I get a lot of feedback when it comes to MCQ. You learn more. So for anyone who is attending my session for the first time, I'm Dr. Abhishek, your mentor for biochemistry at Unacademy. I'm also the author of Biochemistry Basics Flashcard. I take a lot of sessions on YouTube, plus there are a lot of sessions which I take live sessions on Unacademy platform, both free as well as are part of their Plus program. We'll talk about the Plus program as a sponsor for this session in a while. And if you are first time, hi Wasim, good evening. If you're first time visiting this channel or seeing one of the videos on this channel, make sure to hit the subscribe button and smash this bell, because not only me, but there are almost 40 different educators who come live every month and teach free to NEET PG aspirants to medical doctors on this channel on all high topics, high concepts, and you will gain a lot of it. So if you are subscribed, if you have hit the bell icon, you will get a notification. And if you have attended already one of my earlier sessions, I would request you to give a thumbs up to this video so that it can reach more and more students. Before we start today's session, a few announcements from Unacademy end. First of all, there's a NEET PG seasons batch. This is for students who were to appear for this year in NEET PG, but because NEET PG got postponed, so they could not attend. They are still waiting for the exams to happen, so that in this waiting period they don't fall out of the preparation. This is NEET PG seasons batch, which is again the new batch is going to start from 9th of June. That is just 2 days from now. Then we have got target next batch for anyone who is thinking of taking NEET PG or the next year. So this is a batch, and the good thing is that by November your syllabus will be complete. So whenever the next will happen, you will have at least 4 or 5 months to revise and solve the MCQs. This is for second year professional batch. So this is going to make sure that you are, if you are a second year student, you learn all the concept which is important for second year, and you are having complete knowledge of the PG entrance examination question. So whether to prepare for prof examination, whether to prepare for PG entrance examination, you don't have to. This course will make sure that you are knowing all your prof related stuff and all the PG related stuff. you know uh, Educators like Devesh sir, Siraj, Vasant, and Viswajit, all these are going to take sessions here. There's a free grant test for my FMG students. If you are attending, you can go to the Unacademy app and you can give this free grant test. Make sure to use this code to unlock it, because if you don't unlock it, it will be for paid users. If you use this code Dr. Abhishek, then you can unlock it. So let's start quickly with the session. This is the first question for today. Monosaccharide delivered to liver may have different rate of intracellular metabolism. Which of the following substances has the highest rate of metabolism in glycolytic pathway? Which of the following substance has the highest rate of metabolism in glycolytic pathway? Is it glucose 6 phosphate? Is it galactose 1 phosphate? Is it fructose 1 phosphate, or mannose 6 phosphate? So anyone wants to answer this question? So which one will have the highest rate of metabolism? Anyone? So let's look at what is the possibilities. So this glucose 6 phosphate will go into glycolysis, right? If I'm correct, right? This glucose 6 phosphate will go where? It will go to glycolysis, right? What about this galactose 1 phosphate? This galactose 1 phosphate will be converted into UDP glucose, okay? And again to glucose 1 phosphate, glucose 6 phosphate, and again it will go to glycolysis. So even this is going to glycolysis. Now fructose 1 phosphate directly will be converted into dihydroxyacetone phosphate and glyceraldehyde. And the big part is that with the help of aldolase B, and very importantly that it will skip the rate limiting step in the glycolysis. We know that in glycolysis, what is the rate limiting step? When fructose 1 phosphate is converted into fructose 1,6 biphosphate. Okay, So this is the rate limiting step of glycolysis. So this step is actually bypassed when in case of fructose 1 phosphate. So because this rate limiting step is bypassed, this fructose 1 phosphate will undergo a quick glycolysis. And what about mannose 6 phosphate? Can anyone tell me about mannose 6 phosphate? What will happen to mannose 6 phosphate? Remember, mannose 6 phosphate is first converted into fructose. So mannose will undergo the same metabolism at fructose, but first it has to be converted to fructose. So out of all these options, fructose will have the highest rate of metabolism in glycolytic pathway. Is this clear, everyone? So the correct answer here will be C. Very good, Sukhbir, you are correct. The correct answer is C. Is everybody clear about this question? Any doubt, anybody? Okay, let's quickly to the move to the next question. These are all latest pattern questions where there will be a clinical, scenario or a paragraph, and then you will be given a question. So for every day, we will be taking one class. 1:30 to 2. I'm there on Unacademy as a free special session for students. Again, MCQ discussion. And Monday to Friday, I'll be on YouTube this week. Every day, 8:30 to 9. Okay. So a 78-year-old female suffers from nausea, anorexia, fatigue, and skin rash on her legs. She is mildly demented and believed to have severe malnutrition. Lab finding shows an organic aciduria. Okay, you suspect a biotin deficiency that may contribute. Which of the following conversion is impaired with patients of biotin deficiency? Can anyone answer this question? Carboxylation is affected. So the correct answer, so pyruvate to oxaloacetate. Anyone else? Manan says C. Ashok Patel says C. Tina, hi Tina. Tina says C. Anyone else? So pyruvate to alanine. What is this reaction called as? Pyruvate to alanine is basically transamination reaction. Okay, any amino group is going to be given. Okay, and what will be the cofactor for this reaction? Anyone wants to tell? What will be the cofactor for conversion of pyruvate to alanine? Anyone? Let's see. Anyone wants to answer? What will be the cofactor? Vitamin B6. Very good. Vitamin B6 is the cofactor which is required for all the transamination reaction. Let's look at this, the second. Pyruvate to acetyl CoA. This is your link reaction. This is your link reaction, right? And what is the cofactor? What is the most important cofactor for the link reaction? For link reaction, you require thymine as a cofactor, right? Very good. And this pyruvate to oxaloacetate. This is your first step of gluconeogenesis. Okay. And this requires addition of a single carbon atom. Okay. In pyruvate. And this is what will require your biotin. Okay. Biotin. Exactly. So the correct answer here is C. Okay. The correct answer here is C. So all of you are correct. Let's answer. So this question, experiments have shown that tRNA molecule with UCU in the anticodon can effectively bind with AGA and AGG. The finding described above is best referred to as. What is this finding called as? So Tina is saying ambiguity, Manan wobbling, Cyan D, D, D. So almost everyone is saying wobbling. So what happens? U, C, U. So this U should have put the normal pairing is with what? The U should have, U will act as T basically. Remember, U will act as T. So it should pair with A. C will pair with G. And this U should pair again with A. So this is the normal pairing. Okay. But this is called as a wobbling pairing where the third can wobble, which means this U can pair with both A and G. So this is called as wobbling. Okay. So this is called as wobbling, and this is the very important phenomenon which will explain why 31 tRNAs are able to pair with 61 codons. We know that there are 61 amino acid forming codons and 31 amino acid carrying tRNA. So each of these tRNA, you know, can this 31 tRNA will be combining with or pairing with 61 codon, and this is happening only because of this wobbling phenomenon. Okay, excellent. I know, Tina, you would have by mistake typed B. Let's answer this question. Let's answer this question. So this is a titration curve which is shown in your diagram. An investigator is studying epigenetic mechanism, isolate histone proteins, the structural motifs involved in DNA binding and regulation of transcription. The peptide bond of histone proteins are hydrolyzed and one type of amino acid is isolated. Okay. At normal body pH, the net charge is +1. Okay. And this is the curve. So which is the most likely amino acid? Is it histidine? So Manan is going for histidine. Anyone else? So first of all, we are looking at histone proteins which has charge of +1. So we are obviously looking at a basic amino acid. I think nobody should have any doubt in this, because basic amino acid will have additional NH2 group which can accept, because they are bases, they will accept hydrogen ion, and what they will convert into? They will convert into NH3 plus. So basic amino acids have positive charge. This is the first important concept you have to remember. Basic amino acid will have positive charge, acidic amino acid will have negative charge. So out of these options, this is a neutral amino acid. This is aspartate is a neutral, aspartic acid, this is an acidic amino acid. Okay, and only these two are basic amino acid, lysine and histidine. So out of this, what do you think will be this? Okay, Pragya, are you clear why C cannot be there? Now lysine and histidine, all will, both of these will have 3 ionizable group. But is it histidine? Is it lysine? How will you decide? Now, very important characteristic of histidine. If you remember, what are these pK values? One of the pK values of histidine is at neutral temperature, at neutral pH, at our body pH. At our body pH, one of the pK values is there. And here you can see that both the pK values are in extreme base end. Okay, both of these pK values are in extreme base end. So this is the reason this cannot be histidine, this has to be lysine. Is this clear, all of you? This is the reason why it cannot be histidine, it has to be lysine. Because the curve of histidine, one of the curves should be here in the neutral pH. If you see the histidine curve, right? Excellent. Now, this is not an MCQ. There is no option. You have to identify the pedigree chart and let me know. What do you think in terms of inheritance pattern? What do you think of inheritance pattern? This is a chart. Just let me know. What do you think of the inheritance pattern? So what kind of inheritance is showing? Is it autosomal dominant, autosomal recessive? Hi, Pooja. So Cyan is saying X-linked dominant. Anyone else wants to answer this question? Anyone else wants to answer this question? So remember a very simple algorithm which you have to follow. And if you follow this algorithm, any pedigree chart you can solve in less than 30 seconds. Okay. So let me tell you the algorithm. And this is a very simple algorithm. I have taught it many times, but for anyone who is attending. So first thing you have to rule out is mitochondrial inheritance. Don't worry about what is the option given. So in mitochondrial inheritance, what is the here? You find an affected mother and see if all the children are affected. So because here if you see, if there is an affected mother, only 2 children are affected, 2 are non-affected. So it cannot be a mitochondrial. In mitochondrial, with an affected mother, all the children will be affected. Then rule out Y-linked. Y-linked, there are 2 characteristics. First of all, only male will be affected. And second, if there is an affected father, both all the son will be affected. So father to son, 100% transmission. Okay, father to son. There will be cases when all the male will be affected, but it is not coming from father. Be aware. So then you rule Y-linked inheritance. If you have ruled these two, then you have to count the number of male and female. So let's count the number of male infected. One, two, three, 4 males are affected, and let's count the number of female. One, two, three, four, five, six, seven, 8, 9. 9 females are affected. So in this case, what will happen? Either male is greater than female, male is almost equal to female, or male is less than female. These are the three conditions which will happen. If it is male is less than female, first check for X-linked dominant. X-linked dominant, what is the pattern? Father to all daughters, all daughters. Okay, father to all daughters. So if you find a father here, any father you find, here is a father, both the daughters are affected. Here is the father, both the daughters are affected. Here is the father, here is your father, all the three daughters are affected, right? So this is a clear cut case of X-linked dominant. Okay, if male is greater than female, then you should look for X-linked recessive. What is the characteristic? Uncle to nephew, uncle to nephew inheritance. So uncle will be affected, father mother will not be affected, and suddenly the nephew will be infected. So this is called as horse knight pattern. And if the male and the female is equal, okay, or if you don't find any one of these, then you will see if all the generation is being affected, then it is autosomal dominant. And if there is a skipping of generation, for example, if you see both the parents are normal and suddenly one of the children is affected, then it is autosomal recessive. In dominant disorder, normal parent, normal children, affected parent, affected children. So this is the algorithm which you have to follow. Is it clear, everybody? All of you are clear about the algorithm? So why this is X-linked dominant is because here you can see, first of all, there are two reasons. First, there is a female which is more affected than male. Number of female which is affected is more than male. And if you see a father, all the daughters are affected. All the daughters are affected. So this is a very easy way to identify your X-linked dominant. Excellent. Let's answer this question. Let's answer this question. This is again a previous year question, very easy question. A 25-year-old woman with a history that included hepatosplenomegaly with eventual removal of spleen, bone and joint pain with severe fracture and fractures of femur. Liver biopsy was done and showed wrinkled looking cells with accumulation of glucoceramides. So what is the diagnosis? So it is one of the very easy case. Okay. So Goucher, very important. All of you are getting it correct. The correct answer here is Gouchers. So remember, Goucher is ouch. Goucher is ouch. Ouch means it presents with pain. Okay. So, and the pain is so severe and the bone is so tender that you will feel like it is an acute osteomyelitis. The pain will be so severe, the bone will be so tender to touch that you will think that it is acute osteomyelitis. It can even present with pseudo fractures. Okay, pseudo fractures. But this person will be generally between 20 to 40 years of age with no other symptom to present with. Okay, and when you suspect of acute osteomyelitis, you will not find any infection symptom. So you will do an abdominal examination or an ultrasound, and then you will find a hepatosplenomegaly. So what do you do? Whenever you find, you will go for a biopsy, and when you go a biopsy, wrinkled looking cells you will find. Okay, because of the storage of A. So wrinkled sphygmolipids, that is glucocerebrosides. So that is why this is called as Garber. And very important in Gauchers as compared to all the other, is that mental retardation is absent. In Fabry's, Krabbe's, Niemann-Pick, all these mental retardation will be present. And here, up to 20 years of age, up to 15, 20, 25 years of age, the patient will have no other symptom. Incidentally, ultrasound may you will have hepatosplenomegaly or the patient will have bone pains to present with. Very good. Let's answer this question. This is a relatively big question, but read it and try to answer this question. An investigator is studying the activation of N-terminal peptidase in eukaryote. So what is an N-terminal peptidase? We know that amino acid will have an N end and a C end, free N end. In this end, free NH2 will be there and free C end which will have CWH. Now N-terminal peptidase will remove one amino acid from here. Okay, so this is what is N-terminal peptidase. Sulfur containing amino acids are radio-labeled and isolated during, here, during translation of a non-mitochondrial human genome, which means non-mitochondrial means, we are talking about nuclear human genome. Some radio-labeled amino acid bind to amino acyl and peptide and exit site, but others only bind to peptidyl and exit site. So we know that when we talk about ribosome, there is A site, there is P site, and there is E site. So which is the amino acid which will only bind to P and E site and never to A site? Can anyone tell me this answer? If you know this, you will get this question correct. Can anyone tell me an amino acid which will never bind to an A site but always bind to a P site or an E site? Anyone? Anyone? So remember the first amino acid, tRNA-I, that is the initiator tRNA which carries the first methionine, which will never bind on A site. It will first come and bind on the P site only, and from the P site it will move to the E site, and from here it will be expelled. Okay, very good, Piyush, very good. So we are talking about the first methionine here. Okay, and this methionine, the first amino acid for all peptide when it is formed is methionine. But does every every protein starts with methionine? No, because this peptide is frequently removed. The first amino acid is methionine is frequently removed. Are you getting? The first amino acid which is to be formed is methionine. But does that mean all proteins will start with methionine? No, because the first is generally removed. So we are talking about methionine. So here it is asking the anticodon sequence of the transfer RNA charged by this amino acid. So we know that the codon is AUG. So what will be the anticodon for this? So we know that G is basically C, U will be coding for A, and A will be coding for C, right? So it will be CAC. Now this is 5 dash to 3 dash. So this will be 3 dash to 5 dash. So from 5 dash to 3 dash, it will become CAU. Is this clear, all of you? So basically it is talking about the nucleotide, the tRNA anticodon sequence of first methionine. Let's answer this question. An investigator is studying genotypes of wingless fruit flies and using full exome sequencing. Compared to the wild type fruit, the wingless fruit flies are found to have a point mutation in gene encoding wind bud formation during embryogenesis. Okay. The mutation in the gene will cause mRNA transcript to have UUG segment instead of AUG segment. Which of the following is most likely to be affected by this mutation? So there is a UUG segment which is there instead of AUG segment. So AUG codes for methionine. Okay. So that binding of methionine tRNA to 60X complex will be affected. Is this clear, all of you? So what will be happening in this case? So remember how this happens. Now it is not talking about initiator AUG. AUG can be anywhere. Is this clear? First of all, remember, it is not just talking about the initiator AUG. This AUG can be anywhere. So what happens? First here it was AUG. Okay. Now this AUG the tRNA containing your methionine would have come and bound here, but now this is converted to UUG. So methionine is not going to come. Just nothing will happen. Why should the shifting of peptidyl tRNA from A to site be affected? It is by peptidyl transferase. So this and all these is not here. The correct answer is here. The binding of methionine tRNA to the 60S complex will not happen because AUG is replaced by UUG. Okay. Let's look at some easy questions. I know, Manan, I have showed you a lot of tough questions. Now let's focus on a few easy ones. Methyl malonic aciduria is seen in. Methyl malonic aciduria is seen in. Anyone? Folic acid deficiency, vitamin B12 deficiency, pyridoxine deficiency, or both A and B. So methyl malonic aciduria is basically primarily seen in vitamin B12 deficiency. But remember, whenever there is a folic acid deficiency, there will be a secondary or a functional deficiency of B12. Is it clear? And this is called as folate trap. You all know about folate trap? Folate trap, what happens? What happens in folate trap? Okay. Now we know that homocysteine, when it is converted into methionine, it requires a methyl group. Now this methyl group is given by methyl tetrahydrofolate, and this converts into tetrahydrofolate. Okay. but this directly does not give it to the reaction. This is basically by B12. So B12 accepts this methyl group and becomes methyl B12. Okay, and again this gives to the reaction and get converted into B12. So if there is a folic acid deficiency, if there is a B12 deficiency, okay, if there is a B12 deficiency, okay, there will be a folic acid deficiency also. Is this clear, all of you? So this is methyl. So in this case, okay, so when we are talking about methyl malonic aciduria, will it be seen in folic acid deficiency? Yes or no? Yes or no? Folic acid, in folic acid deficiency, will we be seeing a methyl malonic aciduria? Now you have understood folic acid. So if this is deficient, why should this be deficient? But when this is deficient, this will definitely be deficient. So here you have to remember that methyl malonic aciduria is only seen in B12 deficiency. It is not seen in folic acid deficiency. Okay, and when there is a B12 deficiency, folic acid deficiency will happen. Okay, very good. Let's answer this question. A 2-year-old male presents with pellagra-like lesions, passage of amino acid in urine. In a family of out of 4 siblings, 2 are similar symptoms and 2 are normal. Parents are not affected. What is the most likely diagnosis? Very good, Manan. It's a very good explanation because your typical histidine challenge test or Figlu test is positive both for B12 as well as folic acid. So very good, Tina, Pragya, Anindita, Sugandhini. So correct answer is, so this is a clear-cut case of heart nerve disease. Heart nerve disease. Very good. Excellent. Which of the following statement is concerning a 1 week old male infant with undetected classic phenylketonuria is correct? So which of them is correct? Which of them is a correct statement? So this is absolutely wrong. Remember, all aromatic amino acids are essential except tyrosine. Why? Because phenylalanine could be converted into tyrosine. Okay. When this reaction is not there in phenylketonuria, so tyrosine becomes an essential amino acid. So this is absolutely wrong. High level of phenylpyruvate, so phenylketones appear in urine, so this is a correct statement. Therapy must begin within the first year of life. Now this is a partially correct statement. Therapy should begin as soon as possible, immediately on diagnosis, not within the first year of life. And phenylalanine diet restriction is required for the first 2-3 years of life. Again, this is wrong because phenylalanine diet restriction should be throughout the life. Is this clear, all of you? Is this clear, all of you? Right. So this brings us to almost the end of this session. And this was a question I just wanted to discuss. You know, one of my students, Dr. Deepak, actually was asking about, this question, that should I prepare full time or prepare while working? So should I take a job and prepare? And he's obviously a dropout student. He's a post intern. So what do you suggest about this? What do you suggest Deepak to do? Should he prepare full time or should he be working? What is your suggestion for this, guys? What do you think? Should one go for a full-time preparation or should someone full-time? Tina is saying full-time, anyone else? So obviously a lot of this answer depends upon your financial condition because, you know, contrary to everyone what thinks that we are loaded with money, no. We, uh, it's very difficult for us to make our ends meet, to prepare, to work, you know, and to support our family. So if you are financially, if you can manage, I will always suggest prepare full time. And this is a student, why I'm discussing is that many students keep on asking this question. So if you are financially, even if you are doing a JRship, never do a JRship for more than 2 to 3 months. You will have enough money to sustain yourself for the entire year along with your coaching institute fees. Okay. Normally earlier days when you had to join some physical coaching institute, the fees itself should be 1 lakh or 2 lakh rupees, 1.5 lakh rupees. But now with Han Academy, you can get the entire year for around 24,000. So but that is a different story altogether. So whenever if you can afford, go for a full time, never get into that job. Because what happens the moment you start working as a JR, it's a temporary job. First of all, there is no certainty, and what will happen is that they will give you, the timings are not fixed, the shift is not fixed, and you are never get able to come into the group. And remember one important fact: 600 medical college students, 150 in every college, so 90,000 doctors come out every year, and hardly around 20,000 will get a medical PG seat. Rest 70,000 will be struggling. Okay, so it's a very bad number, but remember, you have to come out of this, and for that you require a full-time preparation. Yes, there are times when you are not able to study much more, then you will have to work, or you have a family to support, then you have to work, or you are already into a government job, in a permanent job, then you have to work. But as far as possible, go for a full-time preparation, because then you have a thrust in your preparation. And it's not easy, it's one of the toughest examination. Not any plus two or not any graduate student is sitting. Everyone who sits for these PG entrance examination is a doctor who has slogged for 5.5 years. you know the minimum a doctor will study is the maximum most of the students will study in any other course. So it's very very tough. So my suggestion for anyone, if you can be supported for next 1 year, your chances of PG preparation will increase. Okay, so Piyush, I'll talk about the pricing for a while. So let's talk about Unacademy subscription, who is a sponsor for this session. And luckily, if you were working somewhere, you could never come to a coaching institute and prepare. Unacademy makes that possible. We are there. The best educators are there to coach you right at the convenience of your home. Even if you miss a class, the recorded sessions are there. There's so many benefits. Both Iconic and Plus subscription is there. So this is for Iconic subscription. So Piyush, do you want to go for an Iconic or only for the Plus subscription? This is for Iconic subscription. Okay. So if you use a code Dr. Abhishek 10, you will get a 10% off. For Plus also, let me show you. There's two further, yeah, 3+1, that if you buy for 3 months, you'll get 1 month off. And if you buy for 12 months, you'll get 2 months off. Okay. So these are some of the additional, yeah. This is for Plus. So if you're asking Piyush, it will be 58, okay, for 3 years. And but if this is for Iconic, and the for Plus it is around 45,000. So for just little you can get an Iconic subscription. But in any case, if you use this discount code, and sometimes I would have some special discount coupons, so you can reach me on Telegram if you're planning to buy. And if I would have a coupon, of if I'm about to get a coupon, I will let you know. So that ways you can get a little more discount. Sometimes we have a coupon. Okay. And if you are a first, second, third year student, always go for a longer duration, because then the cost is very, very low, and you will keep continuing using an Academy subscription. So you can hit me on Telegram if you are planning. I'll reply to you. Maybe, sometimes I do have some good coupons which I can share with you in terms of joining the Plus. Okay. Is it clear? And trust me, this is one of the best ways to prepare while you are sitting. अभी क्या होता है ना कि अगर फुल टाइम भी आप प्रिपेयर करो तो क्या होता है, घर में बैठ के यू फील फ्रस्ट्रेटेड. 3 दिन अच्छा पढ़ाई चलता है, उसके बाद फिर यू गो डाउन. बट विथ लाइव क्लासेस व्हाट हैपेंस, देयर इज ऑलवेज समवन, यू आर लाइक मोर लाइक टॉकिंग टू somebody. Okay, and not only you, like is class mein almost 30-40 students have participated in the quiz. So many students are along with you preparing, so it's a very nice way. And think of it, hit me on Telegram if you're planning to buy it. So once again, make sure you subscribe, give this video a like, and thank you so much. I'd like to thank all of the people who have been a part of this session: Wasim, Sukhbir, MK MBBS, Manan, Pragya, Ashok, Tina, Med School Mnemonics, Pragya, again Manan participated, Sayan, Piyush, Prabhu, Lakshmi, okay, Ashok was there, RM Puja, Mishra was there, Vijay Mishra, Prabhu, Sana Mool was there. Thank you all, thank you. Bandru Sugandhi was there. Okay, Seasons K was there. Thank you all. Ashmin was there. Thank you all so much. Please hit me on Telegram if you're planning to get an Unacademy subscription. That way I can help you a little extra. Thank you all. Look, Abdul, uh, the next is a very unpredictable. This is a very difficult question as to answer, but because they are saying that they will go to a clinical pattern. So will they ask about non-clinical subjects, or what will be the distribution? But anyways, I think what they will do is keep the percentage. So now normally 17 questions are out of 300. So I think in next they will be around 10 to 12 questions from biochemistry. This is my guess, but again, let the notification come for next and we will have an idea. But this year also, when 200 questions was there, we were expecting around 10 to 12 questions straight from biochemistry. Okay. So thank you so much, guys. Take care. Bye.